I'm 20 years old. I'm from Uganda, and I'm going to talk about Girls Act. The first time I heard about Girls Act, that was in 2019, around January. My focal person, actually youth focal person at our clinic, told me about it. I was so much eager to know what is about Girls Act, so she initiated me to the program. I came to know about everything that Girls Act does. So I've so much had a lot of experiences in Girls Act. First of all, I've talked a lot of young girls, most of those that have come when they're tested positive. Most of them are always stigmatized. I've always tried to talk to them, give them about my testimony. Of course, I was born with HIV, so I've tried to talk to them and tell them how they can try to take their medicine, adhere well. So I've engaged a lot of young girls, those in school, most of those that are positive, telling them to always study well because I've always performed in class, no matter my HIV status. Then I've also talked to the young people, most adolescent girls. Currently I'm at the university, so I always talk to my fellow young girls at the university, those that are negative, to always, like, most of those that are in relationships. For example, I have a friend of mine who has a boyfriend, so I advised her to go for a checkup, and she went before having any go ahead with that boy. So they went for a checkup and they are now very good in the relationship. So I've experienced a lot of things in Girls Act, and this has created a lot of adherence. Most of the young girls have adhered well to their medicine, and there is less infections among girls in my communities. Then to be a girl leader, it is really interesting being a girl leader. You motivate a lot of young girls. For example, me, I've always been a leader. Like, I've always been inspired by a lot of young women coming up, talking about HIV, so I would be inspired. So it really motivates me to be a young leader, because these other young girls down there, they're always motivated, hearing me, like, talking, come out, like, I speak to them. They're always motivated, like, yeah, I should be like Bridget. Actually, I have a lot of girls that I inspire as a person, so they've always worked, like, to be like me, as I'm, like, as long as they say that I'm doing things that are very good. And of course, being a leader in the Girls Act I've had a lot of struggles, you know, more so like disclosure. That thing is really so terrible to disclose. More so getting a partner, you disclose to them, people around you, friends around you. It is really tough, but the fact that I accepted my status, I said, yeah, HIV doesn't define me, I have to define it. I had to stand out and disclose to people, like, fine, I got a boyfriend, I disclosed, I'm like, yeah, I'm HIV positive. He didn't take it well at first time, but later on he was like, hey, it is fine. And it really, like, I came down because I was having a burden in my heart. Every time I would be with him, I'm like, I'm having HIV. It would really torment me being with him. But after disclosing, I was really fine. But of course, people around you can always be like, she's HIV positive. But I had to stand out. I'm like, I'm who I am. It's not going to change ever since childhood. I'm positive. I have to move on. I've studied. So there's a lot of struggles around discrimination. Then about the young people that are negative, most of them, actually the young girls, most of them now fear, like, you know, being in relationships. Most of them, like, because they fear getting infected. But it is a very big struggle to talk to them. Like, most of them that know that when you're HIV positive, that is the end, you're going to die. So it has been a struggle to me to talk to those young girls, even those that are positive, to feel that they should be themselves and accept who they are. Acceptance is really very, very hard for most of the young girls, most of those that have acquired HIV from when they're already old, like acquiring it from the unprotected sex. But it has been a struggle to bring them on board, to make them accept who they are. So above all, HIV, what I can tell about it, like, it doesn't define us. If you're positive, stay on your treatment, adhere well. And if you're negative, make sure that you protect yourself. If you have a partner, most of the young girls always tell your partners to go for HIV testing. Most of these men, they don't want to tell us to go, but you stand out, tell them, before you do anything, let's go for HIV testing. Thank you so much. I am Bridget.